In Health Source 10 this morning, following the race for the cure, we're shifting the discussion today to advanced breast cancer. Joining us to talk about treatment options and the needs of patients is Dr. Timothy Moore from the Zangmeister Cancer Center and survivor Melody Hoy. Thank you both so much for being with us this morning.
Thank you.
First, doctor, let's explain what we're talking about. How do we define advanced breast cancer?
Advanced breast cancer, in my mind, would be a cancer that would be stage 4. So it would have spread beyond the confines of the regional lymph nodes. That is, it would have spread to the bone, the liver, the lung, skin, areas where breast cancer commonly spreads to.
But obviously it is treatable because Melody's living proof of that. Where do you begin with your treatment options when you're diagnosing this?
Well, breast cancer has benefited from some very basic discoveries over the past 20, 30 years. We now group our cancers into several subtypes according to factors that they express on their surface. So for example, a tumor that has HER2 new expression on its surface is treated totally different than a tumor which has no receptors, does not have estrogen, progesterone, or HER2 new. And that helps guide our treatment options.
And that's something that's just changed in the last few years.
Correct, and our options are expanding exponentially in this area.
Every day. Melody, let's talk a little bit about your story because you hadn't even had a mammogram. You weren't old enough yet. Take us back to that.
It was a shock. I think with everybody, it's a shock when you discover you have breast cancer, and to find out mine was so far along that I was stage 4 was, you think that's a death sentence when you first get the, the information, and here I am, 3.5 years later, and I want to see where, how long can I, progress and have a good quality of life. And that's what I think maybe the difference is between somebody who's diagnosed stage 1. They're looking for a cure, and I'm looking for my best quality of life for as long as I can, be.
Sure. Had you been doing self-exams?
Yes, but my cancer was fairly deep, and I hadn't been doing them regularly enough. So that's a good warning to everybody to, every month check, But and mine had already spread. I have a spot on my liver and a spot on my kidney, and then the lymph nodes around my lungs.
So what is your course of treatment right now?
Well, originally I was doing chemo. Right now I'm doing hormone therapy, and my expectation is to do another hormone therapy after this one. The way the cancer is, because it's not curable, the cancer mutates around the treatment. So I'm hoping to get a year or 2 on each of my treatments before it mutates, and I have to try a new one. Right. And right now, this one's a pretty good one. I have my hair right now, and yeah.
Dr. Moore, what should women out there know, young and old, about this? So this is a cautionary tale.
Well, I think that Melody makes some excellent points, and I think one is that while it's not curable, we don't think of diabetes as being curable, but it's controllable. And as long as you get good care, we should be able to look at controlling the disease and having your quantity of life be as long as it possibly can be with medical science, and also balancing quality of life. And so we try to strike that balance with women, and I think we're doing a much better job with some of our newer treatments.
All right, Dr. Timothy Moore and Melody Hoy, thank you so much for being here, for sharing your story with us this morning.
Thank you.
I think it'll help a lot of women.